name is Ursula, Assistant Director of Clinical Services for CIMA in Phoenix, Arizona. Today I'd like to demonstrate clean bag technique. You might ask, why do clean bag technique? Well, we want to prevent transmission of disease, infection, and pest infestation. I happen to know of a group home that had a severe case of bed bugs. They were so bad that the walls had to be replaced in order to get rid of the bed bugs, costing thousands of dollars for the group homeowner. I don't know about you, but I would prefer not to transport disease or pests to my car, to my home, or to the home of another patient. If you happen to know there's an issue in the home of your patient that you're going to visit, you'll need to don on some PPE and also leave your bag in the car. Use a clear Ziploc bag to put the tools and supplies that you might need for your visit with your patient. I also happen to have a notebook here that is plastic that I keep my papers that I like to use for my visit, and my tablet. I use the surface of this notebook to be a barrier for my tablet, and I'll put that on the table. Today I have my bag here. I'm going to reach into the pocket that's on the outside of my bag and get my hand gel. So with our hand gel, we want to look at our hands, see if they're soiled. If they're visibly soiled, I'm going to need to use soap and water rather than hand gel. I'm going to use approximately a dime size of the hand gel on my hand. Place it down on my barrier there. And I'm going to rub the hand gel all over the surfaces of my hands, getting between the fingers, the fingertips of my hands, the backs of my hands, the backs of my thumbs, my wrists, until everything is dry. We want to take about 20 seconds to do this, and you might ask, well, how long is 20 seconds? Is singing happy birthday twice or humming it? Or you might want to just say it in your head. So once that's all clean, I'm going to pull out my barrier. Your barrier for your bag needs to have a plastic surface so that it's leak proof and you don't get anything on your bag. This is a chuck that I'm going to use today that has a plastic back to it. You can use a garbage bag that's clean to use as a barrier. What you wouldn't want to use is a newspaper or a paper towel, because these items would leak through and get your bag soiled. Now I'm going to put my bag onto the table here, and since I do have a nice clean area, this makes it very convenient for me. But in some cases when I go to a home, there may not be a place for me to put my things. And if patients' private items are sitting on the table, you're going to need to ask permission of the patient before moving their things, or they may get very upset with you for touching their personal items. If there's no place to put your bag, you may need to put it on a door handle, or you may need to hang it with a purse hanger on the top of a door in order to get your bag into a clean area. You don't want to ever put your bag onto the floor. This is not an appropriate place to put your bag and not clean. So, next, before you get into your bag, you're going to want to use your hand gel again. Anytime you get into your bag, dime size amount into your hand. Getting the gel over all surfaces, clean between your fingers, backs of your hands, tips of your fingers, your wrists, your thumbs, and taking 20 seconds to do so. Now I can unzip my bag and get my tools out that I'm going to be using here. I have actually 2 more barriers that I'm going to put down. One that is for clean items and one that is for soiled items. I'm going to put my wipes on this side. I'm going to put all of my tools, some gloves, and then I'm going to close my bag up to keep it clean. One item that you would, a few items that you wouldn't want to put in your bag. You wouldn't want to put anything that is soiled or dirty. You don't want to put your sharps bag in there or any biohazard bags into your bag. You'd want to carry that in a separate bag. I like to usually keep some garbage bags, some disposable shopping bags in my bag to carry those items. Then I'm going to go ahead and do my assessment with my patient. Putting each item over into the dirty section after. Using each item. And oh dear, I've forgotten my blood pressure or my thermometer. So I'm going to need to get back into my bag again. But since I've been touching my patient, I again want to go back and do my hand check. Dyeing size, putting the gel all over my surfaces of my hands, cleaning the tips of my hands, between the fingers, the backs of my hands, the wrists, taking about 20 seconds in order to do that and getting each area clean. Now I can unzip my bag again and get out my thermometer. Use my thermometer and put it into soiled area. Now I'm going to put my gloves on. I'm done with my assessment and have used all my tools. I use the gloves to protect myself from the chemicals. You're going to use wipes that are approved wipes for sanitation and clean the surface of each of my tools. And throwing away in the garbage and getting a new wipe out for each item. It's nice to have a garbage can close by while you're doing your assessment. Well, your patient might not have a garbage bag can, so you might need to carry some bags in your car again, or your bag, in order to have something to put your garbage into. Once everything's clean there, I'm going to let it dry for a minute. I may just talk to my patient and ask some more questions. I might work on my tablet and let those those tools dry off a little bit before I put them in my bag. I'm going to get rid of my gloves here. And again, I'm going to wash my hands with the hand gel. Getting the whole surface of my hands wet in between my fingers, fingertips of my hands, the backs of my hands, wrists. Once that's all done, I can put all of my tools that are clean here and dry back into my bag. I can toss out my barriers. Those in my bag. I'm going to toss out my glass barrier here. And I'm just going to wipe off my tablet here that I've used with the wipe. And one last time, clean my hands before I leave the home.